Tony, maybe you should just not share your full screen and just the.
I have done that. Yeah, yeah.
Wherever you go.
Yeah.
Maybe you should try resharing because your notifications are still coming up. I don't want them to be coming up in the webinar.
I've kept my
You can
handy, so you can.
No, Johnny, rather than sharing your full screen, just go back and just share this screen.
Okay, just a second.
You can reshare.
Sure.
Okay.
Is it fine?
Yes. Good to go. Yes, I think we're good to go, Johnny.
Yeah.
We already see a few participants here. Hi, Mr. Jagdish. Hi, Harry. Hi, Jaideep. Hi, Omraj. Hello, Prathama. Hello, Rakshit. Hi, Suraj. Hi, Vandana. We'll wait for a few minutes for the other folks to join in. Thank you so much for your patience. I see a few more people in. Hi, Alvina. Hi, Gaurav.
Welcome to all of you. I think Gaurav Kamble has logged in from through 2 devices. It may create some echo. Gaurav, if possible, stick to only one device.
All right. So, Professor, do we get started or should we wait for a couple more minutes? Please suggest.
I think we should start on time. It's already 5 minutes. Let us start.
Sure,
Let's start.
absolutely.
Yeah.
Absolutely. Hi everyone, good evening. Extending a hearty welcome to you all to the pre-program information webinar on Executive Program in Healthcare Management by the Indian Institute of Management, Lucknow. I'm Shweta, working as an Associate Director, Product at Emeritus. I'm thrilled to be your moderator for this insightful session. We aim to provide more details and the opportunities that this program offers to you. Whether you're a seasoned professional or looking to elevate your career
Others, please mute.
in the healthcare management
Others,
domain.
please mute. There's someone unmuted.
Shweta, either the background noise is from your side or from others. You can mute the participants, and they can unmute when it is required.
All right. So welcoming you all. Without further ado, let's get our session started. Choni, let's move to the next slide. So the key agenda for today would be, I would be introducing our key speakers for the day. We'll talk about the program details, a quick brief about IIM Lucknow, the program highlights. Then we'll also talk about who this program is designed for. Then what are the learning outcomes you get out of this program? We'll run you through the program modules and the industry experts that will be a part of the program delivery, certification that you'll be receiving at the end of the program, quick word about Emeritus, and we will also have a short Q&A session where you can clarify any doubts or queries that you have with the esteemed program directors. That's going to be the agenda for this session. Let's move ahead. All right. So some of the stats for you, for us to set some context about how the healthcare industry is going and how it's important to be up to date and to upskill in this particular industry. So according to the government of India, India's healthcare industry is expected to grow and hit 50 billion in size by 2025. And we see a humongous increase in funds allocated by the government of India for healthcare expenditure. That's about 137%, which is pretty huge, right? And if you look at the India's healthcare industry, it could grow to about $37 billion by 2030. I mean, these numbers speak volumes about how this industry is significantly growing and how there are innumerous opportunities that are being created and how it's very, very important to be up to date in this field. With that in mind, IIM Lucknow has designed an executive program in healthcare management, which covers various aspects of this industry. Is aimed to provide you with the knowledge and skills related to healthcare economics, healthcare governance. It also enables you to understand the economic and regulatory factors affecting healthcare organizations and not just teaching you aspects of healthcare management. There is a lot more that this program has to offer. It also focuses on resilient leadership and strategic alignment. I think these themes are very, very important today, right? It's not just about understanding how healthcare industry works. It's also to be able to be in a position to lead, to be able to strategize for your organizations, for your business, etc. So this program equips you with the tools and strategies that are needed to navigate these complexities in this industry. And it will help you to align your organizational goals with this rapidly changing environment. This program is planned to start on the March 30th. And with the duration of 11 months, and the program fee would be 3,07,000 plus GST. Moving ahead, a quick note about IIM Lucknow. IIM Lucknow as a school doesn't need an introduction. However, just for the it's the third best IIM as per FT rankings. It's the fourth best B school in India, and it's also internationally ranked 85th. It's the best international ranked as best international program in management for executives. So again, don't want to take a lot of time because you all must already know what IIM Lucknow is and what the brand stands for. So moving further, I quickly introduce our key speakers for today, our program directors, Dr. S. Venkataramanaiah and Dr. Madhumita Chakraborty. I take pleasure in introducing the faculty to you. Professor Venkat is a professor of operations management at IIM Lucknow. He is Lean certified in healthcare. Also holds a PhD in operations management and was a fellow at the Singapore MIT Alliance program at Nanyang Business School, Singapore. He also has been a learner at Harvard Business School, USA, and was a Fulbright visiting lecturer at W.P. Carey School of Business, Arizona State University. In 2009, he has 32 years of teaching and research experience gained from premier institutes in India and Singapore. He's published more than 150 papers in various peer-reviewed international and national journals and conferences, has extensive research interest in healthcare management, operations and supply chain management, has industry interaction with multitude of healthcare and service organizations, including Aditya George Eye Hospital, AIMS, All India Institute of Medical Sciences, Army Medical Corps Officers Training College, Apollo Hospitals, Arvind Eye Care System. I mean, the list is never ending. I have a huge list to read through. If I keep reading through this whole webinar, is not enough. So it talks volumes about the wealth of industry expertise Professor Venkat carries, and blended with academic experience. He has a lot to offer to the program. Thank you, Professor, for joining us on this session. Pleasure to introduce you. Quickly introducing our second speaker for today, Professor Madhumita Chakraborty. Dr. Madhumita is currently a professor in the area of finance and accounting. She's an expert in finance domain and would bring in her expertise into the program on topics such as financial management, corporate valuation, corporate restructuring, etc. She has a PhD from FMS University of Delhi. She's extensively published her research work in several national and international journals of repute. Her research interests include market efficiency, market anomalies, asset pricing, corporate finance, behavioral finance, impact of corporate social responsibility on firm performance, etc. It's a pleasure to have you, ma'am. Thank you so much for agreeing to be with us on this session today. With that, we move ahead and Professor Madhumita will take us through the program highlights.
Yeah, a very hearty welcome to all the participants here. We are very happy to have you on board. And thanks, Shweta, for the opportunity. And as you have just now mentioned, that I'll be walking them through the program highlights. So here we go. I must say that it is, very well curated and a thought through process for the participants in the healthcare. And most of the sessions are designed accordingly. Now, to run through, we are basically looking at the major chunk of the program, which will be the live online lectures by IIML faculty. And mostly those will be scheduled on Sundays from 6:45 p.m. to 9:45 p.m. A bit here and there may happen, like 6 to 9 or something, depending on the batch requirements. But generally, we are looking forward to 6:45 p.m. to 9:45 p.m. on Sundays. So that is how we have designed the online lectures. After that, there is definitely an exciting part of this program, which will be the 5 days on-campus immersion. And this is when you will be coming to the Lucknow campus, not the Noida campus. And we will have more sessions from the IIML faculty when you are at campus here. Then the good part is, since this is a program designed for the healthcare experts, so obviously you get a chance to interact with your peers. And during the sessions, we would encourage you to have a discussion with the professor and among yourselves, so that the peer-to-peer learning happens. And that is what we are looking forward to, so that we have a very nice blend of the professor's expertise as well as your insights, so that we have a full all-round understanding of the scenarios. Then we are looking at the practitioner insight sessions by industry experts. So we do invite industry experts, and there are certain slots that have been assigned for them. We will accordingly invite them over, and you will be informed about their sessions well in advance. So this is definitely a part of it, and they bring a lot on the plate based on their industry expertise. It will have a guided capstone project by IIML. So which will be a project which will synergize your learnings, and we will try to build on your expertise and what you have additionally learned and where you want to take that knowledge to. So that is the kind of work that you can look forward to doing. It will be more based on your enthusiasm of the topic rather than we imposing it on you. So that is how we would like to take it forward. And of course, as we said, you will have networking opportunities with diverse peer group because we do expect a diverse set of participants joining us. Although everybody has experience in the healthcare, but the kind of exposures may be different, and therefore, as you network with each other, there is a great opportunity for learning. And last but not the least, you get the opportunity to get the executive alumni status from IIM Lucknow, which is very coveted. Most people, this is a question that people ask whether we get that. And here is the answer that yes, you get the executive alumni status after the program. So this is about the program highlights. Shweta, do we take questions from them or we just move forward?
Maybe we can take
Later,
later, ma'am. If
All
there are
right.
any questions, they can always
Right.
type in the chat box.
All right.
So,
So I
yeah.
believe the program highlights have been covered. We are moving to the next one, which is who is this program for? So it is for the mid to senior professionals and the healthcare practitioners and the senior consultants and healthcare entrepreneurs. Now, these are the people who are expected to take leadership positions in the years to come, and therefore they may currently have domain expertise, but to rise up the ladder, one would have to have a proper managerial skill and knowledge so that they can blend together all the aspects. And that is the reason we are offering this program, because we do depend on the expertise of our of our healthcare experts currently in the country. But definitely, as we are moving forward and the business scenarios are getting increasingly complex, and it's not just healthcare like the age-old hospitals, but there is a business angle to it as well. So therefore, there is a need to have a proper management of the scenarios, and these are the people who are looking forward to those roles. And so we look forward to these professionals to come and join our program. We are looking at the eligibility criteria of a graduate, that is 10 plus 2 plus 3, or a diploma holder, 10 plus 2 plus 3, with 7+ years of experience in healthcare and allied sectors. So this is what brings a lot of experience on the plate, and that will be helpful for our, as we said, networking and peer-to-peer learning. So this is about the program, the aspirants for the program, right? And Shweta, so
Yes,
I
thank
think,
you so much, Professor.
yeah. So
Thank you
this
for
is
taking us
about
through the
about what I wanted to share with them. So I think Professor Venkat can walk them through the next one.
the key learning. Absolutely.
Thank you.
Welcome,
Thank you, Professor Madhumita ji. Yeah.
Yeah.
Yes. My dear participants, I welcome you all. I join my team and colleague, Professor Madhumita, in welcoming you all for this session, as well as subsequently for in our program. And this program has been designed very carefully by looking at all the possible learnings that we can provide within the number of hours that we have mentioned. And of course, we'll be seeing the further details also. So from this slide, we want to say that, all aspects, by looking at the strategic aspects at the middle level and operational, including some digital and sometimes including workforce issues, including some legal business aspects, etc. So it is like almost, in my language, I can say that this is a fast track MBA. In one word, if I say this is a fast track MBA kind of thing. Looking at profile of the people with 7+ years of experience, we want to give what is exactly required. So very carefully designed, and also as we have already shared the external experts, which we will be seeing further slides. And also we have not only those experts, there are many more experts whom we are going to introduce to you. And we have in terms of I don't want to talk about the cost of the program, which you are yourself can look at it, how we have designed that. So if there is any doubts on these aspects, My colleague already mentioned what are the topics and so on and so forth. This is putting a different template or a different perspective on the content that we have included in the program. Yeah, so that's about this slide. Sweta, next slide, if there is
Yes,
any.
Professor.
Yeah.
Thank you, Professor.
Yes.
Thank you so much. Maybe we'll take a quick pause for anyone to type in the questions that they might have in the chat box. Maybe we'll give them 2 minutes in case there are any questions that they want to type out, and then we will proceed to that's all.
Yeah.
Participants request you, if you have any questions, any queries, feel free to type in. We will have a Q&A towards the end as well, but just in case you have any quick questions, we are happy to take a pause and take those questions.
I can see there is one question. I think you may respond, Shweta.
Yes. So the question is, will you please share this presentation? Yes, we will be sharing this presentation post the session for your reference.
Actually, the contents of this presentation is already there in the brochure itself. Of course, we can share. That's not a problem.
Absolutely. Any further questions before we resume and get started?
You can proceed to next slide.
All right, perfect. So I request Professor Madhumita to take us through the program modules. The next slide.
Yeah, so here I am. As you can see here, the program has been divided into several modules. And the first of these will be understanding healthcare dynamics. This is where you will be introduced to some portion of economics of healthcare landscape, followed by the governance, legal aspects, and risks in healthcare management. These are a very macro aspect in which the healthcare industry is placed, and knowing all these will put the things in perspective. So these are coming right in the beginning. Then you have information systems and biomedical informatics in healthcare organization. So this is about the first module. The second module will be managing people and organizational development, wherein you will have the topics like leveraging HRM healthcare and how the organizations are designed and developed. The third module will take you forward to the organizational functions such as marketing, the supply chain management, the operations, the financial management, the financial reporting. So all these will be the various organizational functions that will be discussed with you from the faculty in the various domains, and they will bring their expertise on each of these topics. Can you please move to the next slide? Yeah. The fourth module will be healthcare leadership. And this is where you will have the strategic management for healthcare. Then the organization's transformational leadership. So for healthcare organizations. And the next topic will be executive presence. And finally, the module will be healthcare transformation, wherein you will study healthcare innovation, entrepreneurship, and design thinking. Digital healthcare, which has become very important these days, healthcare analytics and data-backed decisions. In this age, it has gained so much of prominence, and this is, of course, a part of the curriculum. And lastly, we'll have the Capstone project, which I had mentioned earlier as well. So you will be deciding upon a topic either by yourself or in consultation with the professor. And that is where you will be trying to find out your interest area, what is the area you want to work on, and how you apply the various kinds of knowledge that you bring from the industry, from the classes, from your peer-to-peer learning, and all the learnings you can bring together to build a very nice and enriching project. So this is what we are looking forward to in the Capstone project. So this is the overall curriculum design that we will go through. This will be delivered by our internal faculty as well as the industry experts. So this is about the program modules. Yeah,
Thank you so much, Professor, for taking us through the program
And
modules.
including
request-
the on-campus
Sorry.
module for 5 days. Madhumita ji, just
Absolutely.
to add,
Yeah.
Shweta, I just want to add, apart from these
Sure.
online modules and Capstone, we also have a on-campus 5-day module, which would include 30 plus hours of direct face-to-face sessions in the campus at our Lucknow, probably Lucknow, or otherwise Noida also. Possibly that we have to decide based on the timing and the availability of the facilities, etc.
Absolutely, Professor. Thank you for adding that.
Yeah.
Professor Venkat, I request you to take us through the industry experts in this
Right,
program
right,
and how
right.
they
Go to the
add
next
value
slide
to
then.
the
Go to the slides.
Swati, can we move to the next slide?
Shweta,
Yes.
yes. My dear participants, I want to share with you proudly that we have one of the best resource persons for this program, mainly due to 2 reasons. Let me tell you. Our interest in the healthcare program, as well as the brand name of IIM Lucknow. It is not because of only one, and it is we have been working. Myself and my colleagues, a number of my colleagues are working with the industry very regularly, and the evidence is our own publications around that. So this gentleman Arumugam is the architect of Tamil Nadu model, which he has designed in 1992-93 implemented in Tamil Nadu, which is a WHO standard both for the country as well as outside the country, and a double PhD. He is an entrepreneur. He also comes to our campus, and we are taking him as an adjunct faculty of our campus. And he doesn't need much introduction. Also, you can even go through his LinkedIn profile. You will not find much also in LinkedIn because he is very busy. And the second person is none other than Dr. Deepak Agarwal. He is an entrepreneur, neurosurgeon, AIMS. And you might have heard about during COVID time that Maruti has collaborated with a startup company, Agua Private Healthcare Limited. He is the one of the founders of that company. And he is a thorough gentleman, and aims the entire computerization of at least 10-15 years back has been done. He was the chairman of that computerization, and he is also a regular faculty for our healthcare program at our campus. And I must also tell you that not only this program we are offering online on this platform, and I myself offer elective called healthcare operations management, which is very unique. All these people are also part of our regular program as well. Move on to Sweta. Move on to the next slide. Yes, and this gentleman is from Army Medical Corps, and he is a lean expert, public-private partnership expert, Jagtar Singh, and he is one of the very leading personalities. You might have heard about Academy of Hospital Administration, which is a very prominent industry body or professional body, and he is a retired officer. He sits in Delhi, and he is also again our regular collaborator and a very wonderful gentleman. And he has already taught in the first program, and also in addition to that healthcare program, in the other programs also he comes and teaches in our campus. And the other gentleman is Sachin Gaur. He is a founder of a startup company. He is into AI and cyber security in healthcare. And he is a double MS in healthcare and cyber security from, I think, Netherlands or some European university. and he is the founder of Innovation Curies and one more company located or situated in Delhi. Next slide, please. Yeah, I think apart from this, we have not got the approval to put their names. Otherwise, we have expert from GE Healthcare, Mr. Krishna, who is the MD of GE Healthcare, and we have other people also. And today, in fact, I must also share with my colleague also. One gentleman wrote after seeing this notification from Accenture. Accenture is the head of healthcare vertical in Accenture. He calls me saying that I am interested in associating with this program. So that is the traction that we are getting. Sweta, this is for your information also. And we have such kind of wonderful people who are coming just by looking at what we are doing. It's not because of anything else. So I hope you will appreciate that. In the program also, you will find once you join the program, we have participants from very, very reputed organizations. Not only our brand value, participants' brand value, and industry people brand value is amazing. So this is what I want to convey. And our certification, you already know, and it is for, I want to add my, jovial statement. IIM brand is a big brand, and any brand for that matter, Jindagi ke saath, Jindagi ke baad bhi. So you will be part of this legacy, and which legacy is more than almost close to 4 decades. IIM Lucknow brand is not less, and we don't want to compare with anybody. Let me honestly share with you, because we are unique and we should be unique in the content, its delivery, and its pricing, and its value proposition. And whatever we say, we deliver more than what we say. With that, I will stop here. Let me hear from Sweta what is next. Yeah, Sweta.
Thank you so much, Professor. Professor, we mostly covered what we wanted to cover and discuss with the participants. We open the floor to questions. If participants have any questions, I can already see a couple of questions. I request the participants to put up their questions in the Q&A box. We will be happy to answer. We can start answering your questions.
Sweta, I will just add a couple of more things. Just a couple of more things. As I already shared with you that we have a proven record of many of our individual faculty working in the area of healthcare. You can take a look at our faculty list who are involved in this. Sweta, please put our faculty who are taught in the program in the batch 1, so that they will become easy for them to look at what is the profile of the faculty. Also, instead of we telling, let them connect to their LinkedIn profile. I would recommend Sweta Group to put one slide on the resource persons from IIM Lucknow as well as industry people, their LinkedIn profile in one slide, so that they will also take a look at it. And we are done credibly well, very well. And let me also share with you that I have been working with Tamil Nadu model, UP model, and also AIMS, and we will share those case studies also with you. And we have one more gentleman, founder of IQ Technologies, Sujay Santra, and that is a startup which is, of course, more than 10 years old now. And his startup is also now globalized. And we also have our own alumni who are also into a good number of startups, and particularly in healthcare. We are planning to bring more of our own alumni also as resource persons for our program, particularly second batch. So I'll stop here. Yeah, thank you.
Noted, Professor. When we send across the deck to the participants, we will add the necessary details that you mentioned.
And we can see some questions.
Questions, absolutely. Ma'am, the first question is, Capstone project, will it be individually presented or will it be a group?
It will be a group project.
Yeah, that's the first question. There's also a question on how would the evaluations be done? Is there one exam at the end or regular assignments or grades?
There are exams, but not one. It will be more than one. So after completion of a few modules, there is an exam. After that, there are classes all over again, and then there will be another exam. So it will be a minimum of 2, could be 1 or 2 more as well.
I'll add one more point here about the exam. So don't be skeptical or don't be nervous about the exam. We will make you to interact with our first batch participants to know how easy or how difficult it is, the exam part. just pay attention. Come for, you are not competing for Olympics, and we are not training you for Olympics. So exam part, yes, certainly there is a minimum performance. There is no doubt, but you will be able to make much more than minimum performance. That is for sure. We will make you to learn that experience from our current batch participants. We'll in the next visit or next time, Sweta, please remember, we'll bring 1 or 2 people to interact with the forthcoming batch in the first day itself. Okay?
That will be great, sir. That will be great.
Yeah, please. Let our alumni speak.
Absolutely.
Yeah.
So the next question we have is whether we have any industry experts from hospital administration.
Yes, very much.
All right.
And they are
yes,
certified. They are certified professionals. I myself is lean certified. Jagtar Singh is lean certified, and he does many more things. And like that, there are other people also. Hospital administration. Yes.
All right. Thank you, Professor. There's a question on whether the study material is going to be in the form of hard copy, soft copy.
Predominantly soft copy.
Understood. And
Predominantly
how will the attend? Noted, Professor. And the next question from Shama Shaikh is, how will the attendance be counted? Can we attend sessions later?
No, let me answer this question at the beginning itself. Though this is difficult for many of you, but our requirement is somewhere around 70% or 80%, Sweta, and attendance is compulsory. Just don't look at attendance purpose. You are not a convent. We are not running a convent. The more important thing is, again, I reiterate, more than attendance, your learning experience is very important for us as well as for you, because you are paying and coming. So make that as the point. Genuinely, if you have any problem, then we will, we can't make too much of relaxation, but there could always be some sort of, I would say, condonation kind of thing. But don't look for that. We have not made 100%, but 80%. 80% is easily possible. Yes.
Absolutely. Thank you so much, Professor. Go ahead, ma'am. Go ahead.
The campus visit will be
compulsory.
Informed to them before, let's say, about 1 or 2 months before the campus visit. We can't tell the dates right now. It will depend on so many
only after the completion of the online module it will be there. But we can only expect maybe about 3 to 4 weeks later, not before that. And exact dates is difficult because our calendar has to be looked at, and what is the availability of space and all. So that is the reason. Yes.
Got it. I think that was Harry's question. When will the campus visit be scheduled? I think you already answered that. Thank you. The next question is from Urvi. So how can this course be helpful for the person who has clinical experience only, has no understanding of analytics and economics, but wants to move towards the management aspect of health?
I think I would recommend strongly to bring a clinician in the current batch. There are doctors from Apollo, there are doctors from Fortis, Max, and other things, and they are liking like anything. Let me tell you, you have already clinical experience, which we cannot train or nobody else can train you. This managerial experience, it will certainly help you. For example, how you want to run your own nursing home or in your even big hospital, how finance function works, how analytics can help. So these are, you are not going to, please note, you are not going to build a career in analytics. You are going to use the knowledge of analytics. You are going to use knowledge of statistical tools, etc. Just to give you an idea about how these things can help and make your profession much enriching. That is the substance. If I say you have to build a forecasting model, you are not going to build a forecasting model. Please let me tell you. We will teach you how to use a forecasting model for that matter. We will also teach you how to use supply chain concepts in making your procurement more efficient, or your inventory management in your hospital more efficient. So these are the knowledge sharing sessions, and as well as some simple techniques and tools that is easily possible for you people. You have studied, particularly clinicians have studied a most complex, most complicated medical science. This is only a management science. According to me, management science can be studied and understood and implemented by anybody. MBA or management science is designed for anybody. That's my one sentence answer.
Thank you, Professor. I hope, Urvi, this answers your question. The next question is, will the recordings be provided in case due to emergencies is cut?
Yes. Yes, for a certain number of days. We will inform how many number of days.
Yeah, yeah.
Thank you, Professor. The next question is, would we be provided a
Let me also add. Let me
Sure.
also add here, Sweta. We will be using our own cases as well as international cases. Not that we will be using only Indian cases. We will also be using global cases. Okay.
Thank you, Professor. I think that will give a global perspective as well to the audience.
Yeah,
That is
yeah.
very helpful.
Yeah.
Yeah. So the next question from Vandana is, would we be provided a course calendar with information about the topics, scheduled assessments, the 5-day visit, etc. They're looking for a program schedule or calendar.
How much?
I believe this is usually given once the program starts towards commencement. All the participants would receive a program schedule which outlines the schedule for the upcoming sessions. And like professors already mentioned, we will have the campus visit details towards the second half of the program, where they will have more clarity on the dates, etc. Just one more question. Yes, go ahead, Professor.
Yeah, so I think, Urvi, if it is a subject specific thing, then you can connect to that particular professor. Or academic orientation, or academically oriented issue or doubt, you can connect with me or Professor Venkat. Or if it is something to do with the admin side of it, then Emeritus, I think Shweta and others will be there for you to help out.
What is the question, madam? What is the question, Sweta?
Who will be
Who
our
will be the POC if we have doubts?
Pardon?
So the question, Professor, is, who will be the POC if we have doubts in the course apart from the live lectures? So in the live lectures, obviously they will have the Q&A.
Yeah. Let me. Yeah. Anything related to non-academic, I mean logistics of the program. From Emeritus side, there will be one point of contact, and from IIM Lucknow side also there is one point of contact. There is from our side it is most probably Vishal, and there are a couple of people depending on their other assignments. Maybe a particular person may be allotted for this. In our experience, since the first program was POC is Vishal, it is sensible to make him to continue to be the POC from our side. But there will be for admin reasons, etc. There will be a POC. Don't worry about that. Yeah.
Thank you, professors, for adding there. I think that's the last of questions that we have.
Let me also add, in case if there is any problem in logging into a particular day session at the beginning, our Emeritus support is tremendous. Let me also congratulate and appreciate Sweta and her team. Sweta, your people are that guy Saurabh and others. They are very responsive. Even immediately when somebody is not able to log in due to some cake memory issues, etc. Every day session at the beginning, particularly, they are very attentive. So we don't worry about that. The strength of this program is the responsiveness. Yeah.
Thank you so much, Professor. Customer always comes first for us.
Yeah.
We have another quick question, professors. So regarding healthcare analytics, Prathama wants to understand if there are any tools that you give an overview about, more details about healthcare analytics.
Okay. Ma'am, you want to say something? Madhumita, ma'am?
Yeah, we will be inviting the experts to take care of the healthcare analytics. So we have faculty who do the analytics courses out here. We will be inviting the faculty to do those courses for you.
Yeah. Let me add here. IIM Lucknow has all areas experts, highest level, proven expertise. We'll be using mix of academics as well as industry experts. For example, if I ask Dr. Arumugam to tell about AI applications, analytics in healthcare, he can do wonders. So it is like that. And yeah, as I told you today, we had a cold call or cold mail kind of thing from one of the resource persons from Accenture. These kind of people, the best of the industry, best of our internal will be engaged for every session. Let me tell you honestly. Yes.
Thank you, Professor. That is very helpful. I request the participants to put any more questions that they have in the Q&A box so that the faculty can answer. We might be able to take a couple more questions. So feel free to put your questions in the Q&A.
Let me, if there is no questions or before somebody else asks questions,
Sure.
let me also tell you that the entrepreneurial opportunities through this program, as I could see, are unfold the way it is getting unfolded by the current people. My God, it's amazing. If somebody says that I have a home-based care, can I make some of my batchmates to become my point of contact or my collaborator in another city? There's a guy from Pune. He has a wonderful home-based care model. And in fact, with him, I have now submitted a paper also. I have to share that information with my faculty colleague. And he says that there is more than progress, growth in your own organizations. The kind of entrepreneurial opportunities amongst you is abundant. That depends on you. How do you want to take it? Right.
Congrats, Professor.
Yes, please.
So is it published? You've sent it
No,
out?
ma'am. It is Euro 24. The abstract has been submitted on
Right.
process optimization for home-based care.
Wonderful.
Yeah.
Sounds very interesting, Professor. Thank you so much for sharing that with us. I know this session is too short for you to talk about or describe a lot of things that you might be working on or the experts might be working on in this sector. But we are very, very confident that you have a lot to bring to the table and the participants have a lot more to hear and learn from you through the course. Looking forward to that. We have one more question meanwhile. I think Dr. Jagdish had mentioned that it would be helpful if you are enlightened with various healthcare models in various industries.
Yes, I'm reading that question also. Please let me answer this question. And we will be using the models of India, proven models of India, proven models of US, proven models of Europe, including NHS. Yes, Mayo Clinic, Cleveland Clinic, Ohio, and including our own Indian models, Tamil Nadu model, UP model, Rajasthan model for public health, supply chain, and Arvind, Narayana, and Arvind, the LV Prasad Eye Hospital. And there are a few case studies that we have done for startups. So all of them, the mix of both India as well as outside India will be there. And in fact, the analytics part, which I talked about today with that gentleman, since he worked in both India and Indian worked in US environment, I said on 4 dimensions, compare India and US. So like that, you will find almost in every topic also, or wherever it is applicable. Yes, please. Yes, Dr. Jagdish.
Thank you, Professor. Thank you for answering that. Do we have any quick questions to the faculty? Okay. If we don't have any questions, I think we can quickly move ahead. We mostly covered what, yes, absolutely. Thank you, Professor. Sunny, we can quickly move ahead. Yeah.
Before we close, I'll have a word to say finally. Yeah.
Absolutely, Professor. Thank you so much. I don't want to take a lot of time about Emeritus. Just giving a quick introduction about Emeritus and IIM Lucknow's collaboration with Emeritus. So IIM Lucknow and Emeritus have been collaborating to offer a portfolio of high-impact online programs. Emeritus aids in offering executive education courses beyond in-campus learning in a collaborative and engaging format. We bring about 12 years of experience globally in enhancing careers and enhancing more than 2.5 million global learners from over 160 countries. Emeritus has also collaborated with more than 55 top universities across the world, with more than 300 eminent faculty to offer 450 plus programs. However, we would not want to steal the limelight, because here for us, the hero is IIM Lucknow, the faculty, the credibility that they bring in from the program. And we are we look at IIM Lucknow as a very, very valued partner. And we look at this program as a lot of value add to the participants who are looking to join in. So without further ado, I think we already gave you all the details that are necessary about this program. For any further details, always feel free to reach out to us. Our program advisors will be more than happy to help. It was a pleasure talking about all of these things to you. And I think now it's time for you to dive into this opportunity. Applications are open for this program, and we are offering you a pathway to enhance your skills and accelerate your career. So this is a short ticket to your professional growth, is what we believe in. So you can always email on this email ID or WhatsApp any of our program advisors, or directly call them. So we'll be available through all these means, and we will respond to you as soon as possible. We will also share this deck with you post the session, so that you can go through and understand the program better. So looking forward. Professor, over to you to add any ending notes.
Maybe I would request my faculty colleague towards the end to say thank you. Before that, I want to share just 2 words. And IIM Lucknow has a partnership with Emeritus and a few other such organizations also. Before we go for any such partnerships, we are extra careful, and our credibility, their credibility, joined together, it is, it is more than 1 something and another 1 something. So multiplication or whatever you do, it will be resultant will be a much more than 1 or more than 2 or something like that. So we are very cautious about our collaboration. We respect that, and we are also happy with Emeritus. That's why we are continuing for the second program. That speaks for our satisfaction also. And Emeritus, please, you see that areas where you can improve, and please do that.
Absolutely.
One last suggestion for Sweta. Please put 1 slide about resource faculty names and LinkedIn profile if possible. Yeah.
Done.
Right.
We will do that. So
Ma'am, I will leave it to you to say your words, ma'am.
Yeah, it was a nice interaction. Thanks to the team Emeritus for putting this up and making the clarifications available for all the prospective participants. Participants must be seeing on the screen such a beautiful campus, and I'm sure they were wanting to come to the campus and have a good time here. And we would also love to have you here with us on this great journey, I would say, because this is a wonderful learning that we all have. We also know a lot of things from your experience in the healthcare sector, and we also try to put more on the plate from our existing faculty. And together we make a nice and a very, very value-adding journey for all of us. So that is all I want to say, and wishing all a very days ahead. A happy Holi to all of you, and hope to see you.
Yeah, I also join in extending a happy Holi to all of you. Yes.
Thank you so much, professors. It was great interacting with you. This was a very, very enriching and informative session. And thank you to all the participants for joining in. We really look forward to seeing you in the program, and we all believe that learning is continuous. So welcome to the continuing the learning journey with IIM Lucknow Healthcare. Thank you so much.
Thank you all.
Okay. Thank you. Bye-bye.
Yeah.
Bye.
Bye.